Now that we're talking about that, you have answered it, but I just want to directly speak this question to those corporate leaders that we see, those executives and managers, business owners and entrepreneurs. I've got Dr. Anna Lemke here, and she's a professor of psychiatry. She's part and heads up, I think, the chief addiction center at Stanford. And so she's written a book called Dopamine Nation. And it's really finding balance in the age of indulgence, because we just live in an indulgent world. And so we're going to go through an archetype or an avatar of someone who comes to you with anxiety, and they're often a high achiever. Those are the people we're seeing, having done functional medicine for now 17 years. These people often come to me and they're on an antidepressant or they're on an SSRI, and they're really struggling and they're not coping and starting to affect their performance at life, in life in general. So take us through your process of someone who comes through with chronic anxiety. And I know it's difficult because every patient is unique and you need to look at many, many factors. But just because I think you've got a different way of looking and treating at these patients, how can someone use sort of your understanding of dopamine and getting the book to help them with anxiety?
Yeah, so broadly speaking, just to emphasize the areas in which this approach is novel or countercultural, what I'm basically saying is that we evolved over millions of years of evolution to do things that are hard. We really are wired for pain. And I believe that at least a partial contributor to our current mental health crisis is that things are actually too easy for us, that the world is too convenient, that we are too sedentary, that we are not in our bodies, and that we are in our heads in a very stressful way. So the intervention is countercultural because instead of saying, I'm going to intervene and suggest some things you can do to make yourself more comfortable in the short term, instead, I'm going to intervene and suggest that you actually make yourself more uncomfortable. So instead of saying making yourself more comfortable in the short term, I'm going to ask that you make yourself more uncomfortable in the short term, with the idea being that that will actually make you more comfortable, less anxious down the road. And this is based on the neuroscience of how we process pleasure and pain. And the fact that those two are in relation to each other and relative, right? It's the theory of relativity of pleasure and pain. So if I have a patient who comes to me and their chief complaint is anxiety, of course, I will explore it in its many different forms. But what I will also explore is the role of highly reinforcing substances and behaviors in their lives. I'll include, of course, traditional drugs and alcohol, but I will also ask about how much time are you spending online? What are you doing online? How much pornography? How much video games? How much just watching TikTok and YouTube videos, which we know are highly potent digital drugs that work on the same reward pathway as drugs and alcohol. And in that exploration, just gathering data, what are you using, how much and how often, not only do I discover, their habits or behaviors, but they see them often for the first time. Because again, when we're chasing dopamine, we often lose the ability to be aware of our behaviors. So it becomes real to them. I talk about, why do you use? I talk about problems related to use. And then I essentially invite them to do an experiment. And it is a genuine experiment because I don't know the outcome. And it's something we'll both learn from, but the hypothesis that the experiment is based on is, hey, you're depressed and anxious. You're telling me that, watching YouTube videos or smoking pot is the only thing that relaxes you at the end of the day. My hypothesis is that although that may have been initially effective, that now what you're doing is basically just exacerbating or creating anxiety through that behavior, accumulating gremlins on the pain side of the balance. And the only way we can find out is to do an experiment and have you abstain for long enough for those gremlins to hop off, for homeostasis to be restored, and for us to see what is underneath. And I always warn patients that they will feel worse before they feel better. This is absolutely critical. If I miss that step, they're not going to be successful because they're going to go into withdrawal. They're going to feel like crap. Anxiety, depression, inattention, cognitive function will all be worse. And they'll say, that was wrong. And I'm clearly needing this substance or behavior to self-medicate. So I say to them, What you're feeling is withdrawal mediated. If you can just wait long enough and get past that first 10 to 14 days, a window will open and you will start to feel better, not just better than you did in acute withdrawal, but better maybe than you have in a long time. And if they're willing and able to then engage in that experiment, and we plot out exactly what that looks like. So if it's a digital media, they can't obviously get off screens altogether, but it might be like, I'm going to delete Twitter, or I'm going to delete my pornography sites, or I'm going to block myself from sports betting, or I'm going to throw away my pot and not use it. And, whatever, sometimes we use medications to help with appetitive control, mutual help meetings, although people are usually resistant to that initially. Lots of different things. Hormesis, which is to, when you get a craving, intentionally do something that's more painful than the craving to help you get through the craving, but also mindfulness, urge surfing, all of that. When people come back 4 weeks later in my clinical experience, and also supported by the clinical literature, about 80% of people feel better. And it's a real aha moment. It's like, oh my goodness, either I thought this substance or behavior was helping my anxiety, or I thought there was no relationship between this substance or behavior and my anxiety. And now that I'm not doing it and I feel so much better, I realize that that substance or behavior was fueling this feeling. And I'm feeling much, much better. Now, is a month enough for all comers? No, it's not. Some people with severe addiction, especially if they've had multiple relapses, will need many more months to really reset reward pathways. Some people may have a broken balance and never actually get there. We may need to use medications, but the medications will be much more effective if they're not engaging in the addictive behavior. Some people may not feel better after this exercise. That's important information. Okay, it's not this behavior. There's something else going on. Let's explore further. Some people may not have been able to do it. And then it's okay, do you want to recommit to doing it? Why didn't you want to do it? Let's explore that further. Are you in fact actually not able to willfully control this behavior? Do you need a higher level of care? Do you need to go to an addiction treatment facility where you don't have access? So it's just an enormous amount of information that you get from it, which then you can use to inform future actions. And I really like it because so much of what we do in psychotherapy and psychiatry is talk about emotions and talk about feelings. What we're doing here is we're actually changing a variable in the biological system, stressing the system to see what is true cause and effect here. And it's really, really rich because when people do feel better after this dopamine fast, they are so motivated to make a change in the behavior. I no longer need to persuade them of the value. They're like, oh my goodness, this is clearly having an impact. Let me also emphasize there, after 4 weeks, we do a kind of pros and cons list. What was good about not using? We often hear less anxious, less depressed, more cognitively with it, better able to concentrate, more present, more productive, doing more quality work, right? Because I'm not spending my whole time waiting till this moment is over so I can use. On the cons list, what do we hear? Couldn't socialize, because that's how I socialize with friends. Also, boredom. Boredom is such a big reason for addictive behaviors and also relapse. I had all of a sudden all this time. I was thinking all these thoughts. It was kind of scary. I didn't know what to do with myself. So great opportunity to talk about, well, yeah, what do you do with those thoughts and feelings, and where does it, where does it take you, and what thoughts came up? And then we make a plan for going forward. So I also want to emphasize that most people in our clinic, first time around, who are able to do this dopamine fast for 4 weeks, most of them, even when they feel better, want to go back to using, right? It's not like everyone's like, aha, I've seen the light. I never want to use pornography again. It's like, no, I'd kind of like to go back to doing that, but I want to use less. I want to use differently, right? So then we make a very specific plan for what that will look like. It's a plan for moderation, as well as what are the red flags that you're deviating from that. And it's really interesting to see what people do. Some people are able to moderate. Some people immediately, with first encounter of reuse, have what's called the abstinence violation syndrome and are on a bender. Some people initially are able to manage their consumption, but slowly drift over time. Some people who are able, or even partially able, say, it's really not worth it because using less doesn't really get me what I want, and it just triggers more craving. So actually, I'm going to choose abstinence because it's easier. So anyway, it's all over the map, but it's a very interesting, personal experiment.